So can physical therapy help you with lumbar spinal stenosis? A lot of times people question, if I have spinal stenosis, is this why my legs get heavy when I walk? Is it trouble to stand up for long periods? Do I need surgery right now? Also, is there anything I can do before it gets worse? The good news is there are a lot of other options before you have to jump to surgery. There's a large research study called the SPORT study that actually laid out and explained a little bit about how people respond to conservative treatment for stenosis and how many people really have to go down that surgical route. It gives you a better explanation and a kind of overall view on stenosis. Big walkaway is the people that actually tried physical therapy were less likely to have spinal surgery. They tended to just move better, and overall they said, I felt like I improved. I just felt better. So first of all, what is lumbar stenosis? Now, lumbar just simply means it refers to the area more in your lower back. Now, stenosis is just a term for narrowing. In lumbar stenosis, it's narrowing where these nerve roots actually exit the spine. Typically, when you have lumbar stenosis, when you first start to stand or you start to walk, you'll kind of get some numbness, tingling down your legs when you first do that, or after a period of time. The other thing is it tends to be down both legs at the same time. And the other thing is you tend to feel relief when you sit, lean forward, or you see people that use a walker, or even people using a shopping cart and they flex forward, typically relieve some of the symptoms with classic lumbar stenosis. And lumbar stenosis is very common for patients that have symptoms and don't have symptoms. Now, a lot of times when we rely on that, we get a diagnosis that's based on an X-ray or an MRI, but that's really only part of the story. We have to also consider other things besides that before we have a true diagnosis of lumbar stenosis. We have kind of two extremes, unfortunately. We'll have people that have MRIs that show really advanced severe stenosis that have no symptoms at all. Then we see other people that have symptoms of stenosis and they have very, very mild changes, slight degeneration on X-rays or MRIs. So we have to take the MRI and match it to the person. So how am I sure I really have lumbar stenosis? Well, the MRI and the X-ray, it's not that we disregard it. That's part of the things that go into the diagnosis. You need a detailed history. We want to look at strength testing, nerve testing, balance testing. We also want to check their movements. What brings on their symptoms, what takes their symptoms away, what positions seem to bother it. And all those things together makes up a clinical picture. And an MRI or X-ray is just part of that overall picture. But they all have to match before you can make that diagnosis and say, that's the reason why we're having those symptoms. So the key is that movement testing is really probably one of the biggest things that tells us what's good or bad for this patient. I'll tell people if they go in to see a doctor that gives them a diagnosis of stenosis, to say he's got to be very careful if he never watches you move or talks about positions and problems and when you have your symptoms and when your symptoms are relieved. So the SPORT study that we're talking about actually looked over 13 clinics over 11 states, and we looked at the people that were diagnosed with lumbar stenosis and how they responded to starting conservative care. So there's two groups we looked at, one that chose not to try physical therapy and the other group that actually tried it in the first 6 weeks of having symptoms. So what did they look at? They looked at, after a year, who chose to have surgery and who actually was happy with the results of conservative care. They also looked at how their pain and function acted after that year and if they were happy or felt they improved from conservative care. So from the people that actually chose to try physical therapy, only 21% actually eventually had to have surgery. The people in the group that chose not to do physical therapy, close to 33% actually eventually had to have spinal surgery. So by choosing a little physical therapy ahead of time, there's a significant percentage that actually didn't have to eventually take that surgical jump. So to establish this group, we use a McKenzie evaluation at our clinic here, and we take them through repeated movements. We do it based on the history and how they respond, and then we take them through a series of movements to see which ones seem to provoke or bring on their symptoms, which ones seem to kind of relieve the symptoms and make them feel better. And that evaluation is very unique. We're taking people through a series of time and really asking how do they act with these movements when they go and they move in a certain way. And some of these things correlate to different activities of daily living. And this gives us a very solid diagnosis, and also paired with the MRI, X-ray, and also how they describe their limitations outside of the clinic when they're doing things for longer than we can really reproduce here. Also with the moving testing, we're seeing what positions make things worse, and also there could be a series of movements that actually improve the pain levels. After we do certain movements, we say, wow, when we do this movement, we can squat better, we can stand longer, we can walk longer. And this tells us a little bit about the diagnosis of stenosis. That quick, rapid change is really what we're looking for, and also a consistent pattern to their symptoms. So early PT, basically what we see is a less reliance on medication, improved functional outcomes, and decreased use of medication to manage pain. And if you eventually have to do surgery, they find that the people, they're stronger, they're better conditioned, they do better post-surgically if they've done some pre-physical therapy or pre-surgical physical therapy. Their outcomes are better. So even if you don't have success, you do better with getting a little stronger, a little bit more mobile, and functioning a little bit better. So our big walkaway is don't get concerned as soon as you see that MRI and it shows lumbar stenosis that you immediately have to do surgery. It's really dependent on trying some conservative care first before we jump to injections, surgery, and more invasive type activities. So take a pause, see your therapist, get a good plan, and then from there we'll learn more about it and realize that the MRI and the X-ray isn't a sentence. It doesn't mean you have to do surgery, and absolutely we have to look at the overall clinical picture. All right, hope this helps you out. If you like this, hit our like button, subscribe, hit the notifications if you want to hear more about it in the future, and place a comment if you have something that you have a question about. All right, have a great day.